Do you know the warning signs of a stroke? It's a question that could potentially save a life, perhaps even your own. Strokes are a medical emergency, a sudden interruption of blood flow to the brain, often resulting in long-term disability or even death. But here's the thing. Strokes don't just happen out of the blue. They often send out warning signs like flares in the night sky, signaling that something is wrong. These signs can be subtle, like a sudden difficulty in speaking or a sudden numbness on one side of the body. Or they could be more obvious, like severe headaches or vision problems. Recognizing these signs is crucial because the quicker you get treatment, the better your chances of recovery. So let's delve deeper into these warning signs. Let's arm ourselves with knowledge, because knowing these signs can help save a life, maybe even your own. Before a stroke, many people experience what's known as a mini-stroke. These mini-strokes, or transient ischemic attacks, are brief episodes of neurological dysfunction. They are often the body's way of waving a red flag that a more serious stroke may be on the horizon. Now you might be wondering, how can I tell if I'm having a mini-stroke? Well, there are a couple of simple tests you can do. First, try smiling in front of a mirror. If one side of your face droops or doesn't move as well, that could be a sign. Another test involves lifting both arms simultaneously. If one arm drifts downward or you struggle to raise it, this could also indicate a mini-stroke. Remember, these are just tests. They're not definitive diagnoses, but they can provide an early warning. And when it comes to strokes, early detection is key. So if you notice any of these signs, seek medical help immediately. Now let's dive into the warning signs of a stroke. These signs can help you recognize when a stroke may be imminent, potentially saving a life. Firstly, you might experience numbness or weakness, particularly on one side of the body. This could affect your face, arm, or leg, and often occurs without warning. If you notice a sudden loss of strength or a strange sensation, it could be a sign that a stroke is on the horizon. Secondly, confusion may set in. You might find it difficult to understand what others are saying or struggle to articulate your own thoughts. This could be accompanied by slurred speech or difficulty finding the right words. Another warning sign to be aware of is vision problems. You may experience sudden blurred vision or even temporary blindness in one or both eyes. This can be a disorientating experience, but it's crucial to recognize it as a potential stroke symptom. The fourth sign is dizziness, often accompanied by a loss of balance or coordination. You might feel unsteady on your feet or have trouble walking, which can be especially alarming if it happens without any apparent reason. Lastly, a severe headache can indicate an impending stroke. This isn't just your run-of-the-mill headache. It's typically described as the worst headache of your life, coming on suddenly and without any identifiable cause. It's important to note that these symptoms can occur alone or in combination, and they can be fleeting or persist over time. But don't brush them off. If you or someone else is exhibiting any of these signs, seek immediate medical help. Don't attempt to drive yourself to the hospital. Call for an ambulance instead. Remember, time is of the essence when dealing with a stroke. The sooner you get to a hospital, the better your chances are of minimizing the damage and making a full recovery. Recognizing these warning signs could literally be a life-saving action. In summary, recognizing the warning signs of a stroke can make a significant difference. We've highlighted the importance of identifying mini-strokes, those seemingly insignificant moments of confusion, difficulty speaking, or sudden dizziness. These are often precursors to a larger, more dangerous stroke. We've also discussed the critical warning signs of an impending stroke, such as numbness or weakness on one side of the body, vision problems, and severe headaches. These symptoms should never be ignored. It's paramount to seek immediate medical help. And remember, don't drive yourself to the hospital. This knowledge could be life-saving, for you or for someone you care about. It's essential to stay vigilant, keep informed, and most importantly, take action when necessary. If you find this tip helpful and want to see more like it, hit that subscribe button and click the notification button for more videos. Also, don't forget to like, share, and comments below for your thoughts. Stay healthy.